Hi there, my name is Jessica, and I'd like to talk about substance abuse disorder in the United States. We know that substance abuse poses a major threat to the American health population and is responsible for the destruction of millions of individuals, families, and communities. We know that over 22 million Americans have been identified as suffering from substance abuse disorder, and it has a major impact on individuals, families, and their communities. They are more likely to face economic hardships, legal problems, unmet developmental needs, health problems, and violence. Children being raised in families suffering with substance abuse are at increased risk of developing a substance abuse disorder of their own. Communities bear the weight of substance abuse through increased healthcare costs, homicides, domestic violence, child abuse, motor vehicle crashes, sexually transmitted infections, and teenage pregnancy. Substance abuse has been used to exploit lower class populations. History has shown prejudicial bias against those who abuse substances and those who are of lower class. Lower class populations have been associated with poverty, lower education levels, racism, low income, and poor housing conditions. We know there's an established connection between substance abuse and mental health disorders, and it affects nearly 8.9 million people every year. Drugs can trigger a patient's mental health disorder. Those suffering from mental health disorders may attempt to self-medicate with addictive drugs. In turn, they end up with a substance use disorder. Only 7.4% of these patients will go on to receive appropriate treatment. Back in the 1950s, there was a disassembling of institutionalization. In 1966, a legal requirement was introduced requiring hospitals to discharge patients to an environment less restrictive than a hospital. By 1975, a person had to be declared a danger to themselves or others to be confined. And then in 1999, a person with mental health illness was then considered a disorder. This required all governmental agencies to make reasonable accommodations in the community for treatment. Since then, most state hospitals have been closed and the availability of inpatient beds has been severely limited. Many of the patients that now seek treatment and acute care are often discharged back to the streets. We're going to apply the social ecological model considering the complex relationship between the individual, relationship, community, and societal factors. This will allow an understanding of the multitude of factors that increase susceptibility of substance use disorder. We can then identify key factors in each level of the social ecological framework. The individual level analyzes genetics, mental illness, age, race, immigration status, educational level, and income. Relationships include environments within the home, work, and school, and seek to identify characteristics of these settings associated with higher substance abuse. Community involves norms and attitudes, cultural norms, and bias related. Societal factors considered will be directed at advertisement and marketing strategies, along with policies related to substance abuse. Providing evidence that is cohesive to the social ecological framework is instrumental in prevention and supportive of population-focused interventions. Using the social ecological framework to recognize key factors for each individual patient with substance abuse disorder and which level of intervention is appropriate. From there, one can ascertain which program will be most beneficial to the patient. Often people suffering with substance abuse feel isolated, and attending community groups may be helpful. They may be able to identify with others or provide a sense of belonging. Other patients may need intensive psychiatric treatment provided by highly trained or experienced psychiatrists inpatient, which we know is unlikely, so they will most likely be discharged outpatient. Medications to help with addiction and manage withdrawal symptoms may also be useful, and ongoing counseling for these individuals may also be an important factor to their success. The real key to long-term success for substance abuse in the U.S. is prevention. We have traditionally been reacting to the substance abuse epidemic in a crisis mode. We need to stop being reactive and turn to a proactive approach. As advanced care providers, we should shift our focus to attention on the details of prevention and management of mental health disorders. While those currently suffering will continue to need lifelong treatment and support, which we must also provide, we know that research has shown that there is a direct link of substance abuse and mental health, and by effectively managing mental health and providing education to these patients of their increased risk of developing substance abuse may provide another angle of prevention. Primary care physicians are in a unique position to help monitor for substance abuse. We can ask patients about their drug regimens and clue in on if a substance abuse disorder exists or if they have the potential for developing one. When patients are suddenly asking for increases in the amount of medications they receive or asking for early refills, should clue you in and suspect that a substance abuse disorder might be developing. We must also consider the link between mental health illness and substance abuse, and if only 7.4% of them are receiving appropriate treatment, we have substantial room for improvement. Continued research is being done to determine the best practice approach with these patients, and behavioral health therapies remain the cornerstone treatment of long-term success. We should research them well to understand their benefits. Utilization of prescription monitoring programs may also be useful. Using a prescription monitoring program has shown lower rates of opioid prescribing and overdoses. The program allows physicians and advanced practitioners to closely monitor their patients' controlled substances. The PMP also includes pharmacists. Pharmacists are entering the controlled substances they dispense into a system, and they can help monitor for doctor shopping. States, law enforcement, and insurance programs can also utilize this information to track prescribers and patients alike to determine contribution to the opioid epidemic and overprescribing. According to the National Institute on Drug Abuse, after implementation of a prescription monitoring program, that 4 or more drug schedules was predicted to have a 1.55 fewer opioid-related overdose deaths per 100,000 in the population. There are many techniques that can be incorporated into behavioral health therapies. They have shown evidence to support the usage on patients with substance use disorder. One therapy intervention that can be easily implemented is relapse prevention. Relapse prevention is well researched. It's a cognitive behavioral approach to drug abuse, as stated by McHugh, Heron, and Otto in 2011. You'll focus on identifying high-risk situations with the patient, such as certain places and friends who also abuse substances, and techniques to avoid them. We can then measure outcomes by gathering and assessing data on when a patient first initiated relapse prevention, if they relapsed, and how long they went before they relapsed. And then finally analyzing a patient's perceived effects of relapse prevention. In conclusion, we know that millions of Americans are affected by substance abuse disorder. Prevention remains the key component of solving the opioid epidemic. Primary care providers play a critical role in detecting, treating, and managing those with substance abuse disorder. We must also consider that when treating these patients, that underlying mental health illness may be contributing to their substance abuse. Utilizing behavioral health therapies along with prescription monitoring programs will help reduce overprescribing of opioids and ultimately lead to reduced overdose-related deaths, improved individual and family lives, and hopefully break the cycle of substance abuse. Thank you everybody for watching.